Hi, Ms. Chase. I'm Cheryl. I'm going to be your nurse this afternoon.
Nice to meet you.
Nice to meet you. I received handoff communication from your nurse in the emergency room, and they told me that you were admitted for abdominal pain.
Yes, my stomach was really hurting last night.
Okay.
It was getting worse and worse, and when I had a bowel movement, there was blood in it.
Oh my goodness. I'm assuming they told me they took some labs down in the ED.
Yeah.
Okay, so I just want to verify your hemoglobin's okay, because that's something that we get concerned about when you lose blood.
I've been very tired too, so tired for so long and really thirsty. I just can't get enough water.
Now, they did tell me down in the ED that you did have a very high blood sugar, and so there's a concern that you might be diabetic, and you're going to learn more about that while you're here. Matter of fact, we are going to need to check your blood sugar again soon. I can see that on my intervention list that we do need to recheck your blood sugar. What we're going to do is, let's talk a little bit about your history. Also, the abdominal pain. They gave you something for pain down in the ED. How are you doing right now?
It's starting to hurt again.
Okay. You know what? Why don't I get you something for pain to get you comfortable, and also we'll just go ahead and recheck your blood sugar so that way we can move forward with gathering this information. Now, they gave you Dilaudid down in the ED. Did that work well for you?
I think so, because I did feel better afterwards.
And the only medication that I see you're allergic to on your list here is latex.
Oh. I don't know. You know, I took some, I think they told me one time not to take heparin.
Okay. You know what? We'll talk about that in just a
Okay.
moment, but you've had no problems with any type of Dilaudid pain medications?
No.
Okay, I'll be right back. Mrs. Chase, I just need to verify your armband. Can you tell me what your birth date is?
June 11th, gosh, I'm so confused. I think 62.
Okay. Okay. Well, that's what I have in your record, so. Okay. What I'm going to be giving you is Dilaudid. And tell me where your pain is exactly.
It's in my stomach,
Okay.
right here.
Right there in the middle. And on a scale of 0 to 10, 10 being the worst pain you ever felt, what would you rate that pain?
It's about a 6.
Okay. And what makes the pain worse?
If I kind of move around, or sometimes even if I'm just laying still in bed, it hurts really bad.
What makes the pain better?
So far, just the medicine.
Just the medicine's been working for you? And do you have any other symptoms along with it? Do you feel nauseous?
No.
Okay. And would you describe it as sharp, aching, stabbing, burning?
It's sharp.
A sharp pain. What is your goal? I know this is a silly question, but on a scale of 0 to 10, where would you be comfortable at? Would you like for us to get you to a 0, or would it be tolerable if you were at a 1 or a 2? You're at a 6 right now.
I think a 2. That would be good.
Okay. So we're going to work towards that goal with you.
Okay.
And now we're going to take a look at your blood sugar. Let's check that. And again, I'm just going to verify your armband and compare your birth date. Going to feel a poke. And we can check that off our list. Okay. But let's go ahead and, if you don't mind, there's a few things on your history we need to review. Is that medication starting to take effect
It
for
is.
you? Okay, great. Do you currently drink alcohol?
No.
Okay. Have you ever smoked, or do you smoke currently?
Yes, I did smoke. I just quit.
You did? Okay, and how long did you smoke for?
20.
20 years. Okay, and when did you stop smoking?
8 months ago.
Wonderful. That's a great accomplishment. How's that going for you?
Pretty good. It's hard though.
Good for you. That's a great accomplishment. Okay, so I'm going to indicate here you were a former smoker within the last 12 months. Now I want to go over some information about who all needs to be involved in any education that we provide for you. who takes care of your medications?
I do.
You do? And what about your doctor's appointments? Who makes those for you?
My husband does that. I work midnight, so he takes care of that during the day when I'm sleeping.
Okay, that's understandable. The doctor's offices are mostly closed, right?
Mhm.
What about meal preparation? Who does that?
He does all the cooking.
Does he? Okay, so we'll want him involved when the dietitian comes to see you to teach you about meal planning.
Okay.
Is there anyone else you want involved in your education?
I don't think so.
Okay. Okay. Now, like I indicated about a dietitian consult, what we can do is we can actually consult the dietitian right here from your history. By me indicating yes under patient qualifies for a dietitian consult, that's going to send a message electronically to the dietitian to pay you a visit. Now it's a little later in the afternoon, so it'll probably be tomorrow that we're going to do
Okay.
that. And they did tell you down in the ED that you were planned for to have a colonoscopy.
Yes.
And that's where they're going to take a scope and they're going to look up into your large intestine and see where that rectal bleeding might have come from. Did the physician explain that to you? And
He did.
okay, and you're agreeable to have that done?
Yes.
Did you have any other questions about it?
No.
Okay, I'm going to be bringing in a consent for you to sign to have that procedure done. And also this evening we're going to begin in on your pre-procedure checklist.
Okay.
Okay? And I want to review the medications that you told the emergency room nurse that you're taking, just to make sure we have everything clear. I see that you take Toprol 50 milligrams twice a day. That would be for your blood pressure. You also take Prenavil 10 milligrams once a day for blood pressure. Now, why do you take the Zantac? I didn't see anything in your history that indicated why you would be taking Zantac.
I had to start taking that when I developed a bleeding ulcer from taking too much ibuprofen.
Okay, so you know what, that's important for us to know in your history. I'm just going to go in here and modify and add some information. Now, anytime a patient is in the hospital, they're at risk for developing a blood clot. Reason could be because of lack of movement or just other situations that could occur. So we like to do what's called a VTE prophylaxis because we'd like to help to prevent that. So I remember you saying, you know, one of the things we do to help prevent blood clots is that we give patients an injection of heparin. Now, I recall you saying a moment ago that you'd been told before that you have an allergy to heparin.
Yes.
What happened when you had heparin? Did you break out in a rash?
Yes, I did. I had bumps all over.
Really? And did you ever hear the term thrombocytopenia?
Oh, maybe.
Okay, because that is usually what we see. It's called heparin-induced thrombocytopenia. And we have some information on it right here in the computer. I could print it for you, but I also have somewhere else I could go to print something a little bit more patient-friendly. But basically, it just explains how thrombocytopenia occurs. You know, heparin is a blood thinner. Because it's a blood thinner, it kind of affects your platelets. So let's put that in your allergy, or check to see here. Because of that, we'll be excluding you from this, and the physician will find something else to do for you to help with preventing blood clots.
Okay.
And if we go back to our intervention list, it's going to give me a reminder when we're all done here to make sure that I input that allergy for you. And the last thing I'd like to do is just review your care plan. We have a plan of care while you're here, and it's going to talk about pain as well as glycemic control because of the diabetes. So I'm going to leave this up here for a moment so that we can take some time to review it together.
Okay.
Okay?